Welcome to Ask Dr. Geier Live, wherever you're watching. I hope you're making today your masterpiece. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help athletes and active people like you feel, look, and perform your best regardless of age or injuries. This is that one time of month, one day, one place of the month where I answer your questions and do it in a live format. I don't do it in response to emails, in response to comments in YouTube or anywhere else, but this is your chance to ask your questions about injuries, surgeries, regenerative medicine treatments, and regenerative orthopedic treatments. It could be peptides, exosomes, stem cells, PRP, penicillin polysulfate, vitamin supplements, anything like that, surgeries, rehab, whatever you've got, this is your chance to ask questions. I stay for as long as there's questions. That could mean it could be a 5-minute show or it could be a 20-minute show. I am curious to see what kind of turnout we have, because the rest of the world that does not celebrate daylight savings time may not realize that we are an hour off compared to what it has been, so we will see. As always, please remember, I am not giving specific medical advice here. This is meant for general information, general education. I haven't seen you, I haven't examined you, looked at x-rays, MRIs, any of that, so I cannot give specific medical advice. This is really more meant for, if a doctor told you something and you don't understand it, maybe I can help translate that or give you an idea of maybe information that you could take to your doctor and ask if that is potentially right for you. Also, if you're watching this on X and the questions are not coming through, come over to YouTube and do it there. If you're on YouTube and can't figure out where to ask questions, figure out where Mike's question is. That is in the chat. Find that. Enter your question right under that or in that stream. If you leave it in the comments, I cannot see it and I will not be able to answer your question because I won't know it comes through. I'm not actually on YouTube now, and so I don't see those. And I say that every time. I know if I sound like a broken record, but every time afterwards, as I sort of clean up the YouTube channel, do some admin things on the back end, I will see 3 or 4 questions left in the comments to this video, and I never get to see it. So definitely look for Mike's comment and leave your question there. And again, I will stay for as long as needed, and it could be short, it could be long. Also, if you're a military veteran and you have a question about your disability claim, that is the next show I'm doing on my Veteran Nexus Letter channel. So join me there at 5:30 Eastern Time, so a little less than 30 minutes. And right now, the only question I have is Mike, and so Mike, you're going to get a longer answer. I was watching an interview with Keith Barr, a tendon researcher. He said lower limb PRP, platelet-rich plasma, is useless because the PRP gets pushed out during movement because there's no immobilization. Thoughts? A few things. First of all, I think that would really depend on what the body part is that you're being treated. I think generally, I don't know that I necessarily always agree or always disagree. First of all, I like PRP, especially if it's high platelet concentration platelet or PRP. Not all PRP is made the same and is equal, so I think that is important to know, but it depends on what you're treating as well. Something inside the knee, osteoarthritis for instance, would be very different than a hamstring tear, for instance. I think very different, both in terms of effectiveness of the PRP, but also could you immobilize? Generally, immobilization is a terrible idea for the lower extremity. The knee, for instance, the damage that would be done by immobilization of the knee in terms of the damage to the articular cartilage by not moving it, not having that synovial fluid moving throughout the knee, which has been shown how detrimental that is, that would be far worse than any potential downside to the PRP. So I don't particularly worry about that, but again, it might depend on what the specific injury is. I have not seen any data to support what he's saying, that if you immobilize the lower extremity that the success rates of PRP are higher. I haven't seen anything in any lower extremity injury, but maybe there is and I just haven't seen it. So I think it really would be very specific to the particular injury. But you know, you're also, it depends on how much you're relying on a very local effect. Some of what PRP does is an anti-inflammatory effect as well, so it depends a little bit on that. But otherwise, no specific thoughts. I like PRP. I think there's other things that tend to work better, but as far as treatments that come from the patient, so you sort of miss any or avoid any issues with tissue or cells from somebody else. You potentially avoid that issue. I do think it is very dependent on how it's administered, the specific platelets, and how it's manufactured, and all of that plays a role. It's not one size fits all with PRP by any stretch of the imagination. All right, that is the last question I see. If you have a question that you want to ask it now in the next 30 seconds or all. So if you're potentially interested in hearing more about a variety of different options other than surgery and other than cortisone, I am happy to potentially see you as a patient, assuming it's an orthopedic problem. I can only see patients in the United States, and if you're outside of North and South Carolina, as I practice in Charleston, South Carolina, but I do have a North Carolina medical license as well, you would have to come to our Charleston office at least for that first visit, but depending on some other factors, we can do a Zoom consultation to sort of discuss it in general before you come to Charleston to see if it's a fit. If you are interested, there is a link in the description below this video where you can fill that out basically, and that gets to me and my assistant, and we can talk to you about potentially setting up an appointment to see me. Pamela asks, I assume that's synovial fluid. That is the lubricating fluid inside of a joint, knee, shoulder, hip, that type of thing that moves all throughout the joint. That's what builds up in abundance when your knee or whatever body part it is swells. That's synovial fluid. But if you're interested in that, click the link in the description below the video. Go to that link. It's a contact form. Fill all that out with information about your injury or problem, and we will get back to you. Also, there is a link in the description below this video that offers an ebook that I have written called The Arthritis Solution, but it applies to way more than just arthritis, pretty much all orthopedic injuries, and it's about integrative orthopedic options. Peptides, other regenerative treatments, supplements, modalities, PEMF, red light, hyperbaric oxygen, all of this types of stuff, penicillin polysulfate, exosomes, PRP, stem cells, it's all in there, so definitely check that out. It is, again, not trying to convince you of necessarily of any of that, but it gives you a little bit more information as to what all of this does. I very much appreciate it. Very, very short show. I greatly appreciate it. I will be here December 1st. That is Monday, December 1st, 5 p.m. Eastern Time. I very, very much look forward to it. I've got some other regenerative treatment questions and videos coming in the next few weeks, so definitely check those out. Pamela asks, how do we get that back after tibia surgery? I'm not 100% sure what that means. Synovial fluid, if that's a follow-up to the last question, would not be involved in the tibia. The synovial fluid would be in the knee, not in a tibial shaft, like down the lower leg. So, yes, very short, but you're welcome. Yeah, it's a show to answer questions people ask, so if there aren't any, that's kind of the nature of it. Sometimes these will go 30 or 45 minutes, you never know, but very, very much appreciate it. I will see you all December 1st. If you have questions, definitely join me then, and I very much look forward to it. I hope you have a great rest of your evening. Take care.